Okay, great. Hello, everybody. Thank you for joining. We are really excited to have you all today. We're excited to have our panelists here and for everyone joining the discussion. We've got a great panel of experts and a super interesting topic. Today, we'll be discussing what happens at the intersection of growth and nutrition. So, two topics that we all can definitely relate to. A few housekeeping items before we get started. This webinar is being recorded, and once the webinar is over, we'll be sending it out to all of you via email with additional resources, a couple other links we've talked about if we end up talking about other topics with links and resources. And we will also be sending off a 25% coupon for you to use on our Healthy Heights website. So please give us 24 hours to get that email out to you. If you have any questions throughout the webinar, please drop them in the chat box below, and we will try to get to them at the end of the webinar if we have time. So let's get started. I'm going to introduce our panelists. Today we have Dr. Bryce Liddell and Heather Liddell joining us again, and a new guest, Bryce Wylde. Thank you guys for joining. We're super excited. To start off with some bios, Dr. Liddell here is a board-certified pediatrician, and Heather Liddell, his wife, is a registered dietitian nutritionist. We had them on our last webinar, which is why they probably look very familiar. Through their blog, podcast, social media accounts, and feeding coaching services, Brian and Heather help families keep their kids healthy and learn to feed them with freedom and grace. We know that there's so much noise around, the best way to parent, but Brian and Heather work really hard to provide evidence-based medical and nutritional information in simple and clear ways to empower parents to make the most educated choices for their own families. And then we have our new guest, Bryce Wylde. He's one of Canada's leading alternative health experts. Bryce is a highly knowledgeable and respected natural healthcare practitioner whose focus is rooted within functional medicine. Bryce specializes in homeopathy, clinical nutrition, supplementation, and botanical medicine. So welcome all three of you, and thank you for joining us today.
Thanks so much for having us. Thanks, guys.
So as I mentioned earlier, today's discussion is all about what's happening at the crossroads of nutrition and sleep. Earlier school start times, screen-related distractions, and other external pressures have contributed to 52% of American children getting less than the recommended 9 hours of sleep per night. It's definitely a significant chunk of our youth affected by this. This lack of sleep can affect a child's development, impacting things like focus, energy, growth, and even appetite. Today, we'll be covering sleep quality and how good nutrition can have a positive impact, the role sleep plays in your child's appetite, easy tips for improving your child's sleep quality, and then fact versus fiction, what foods you should stay away from before bedtime. So just get on with our topics and questions, which is why we're all here today. I'm going to start with some questions for our pediatrician, Dr. Liddell. So first off, how much sleep do children need at different ages?
Yeah, so I think the amount of sleep changes a lot based on their age, right? So kind of tossing infants aside, infants under 4 months old, they just sleep all the time. So there's as much as they can get, the better. And then I think of the rest of infancy, so like 4 months to a year old probably needs 12 to 15 hours a day. The toddler age group, more like 11 to 14. Preschool age, 10 to 13, and then once in school age, we're shooting for like 9 to 11 hours. And then our adolescents, we really still try and push that 9 hours of sleep a night.
Okay, great. Good to know. So what are some signs that parents can look out for that your child may not be getting enough high quality sleep?
Yeah, one of the things we look for the most in clinical medicine are those symptoms. So things parents might pick up on would be your child waking up in the morning with a headache, waking up not feeling rested, even though they were in their bed for the recommended amount of time, possibly struggling academically if they're school aged, where they're having trouble maintaining focus or attention, just their overall performance, maybe not just academically, but in some of their extracurricular activities. Those are the big things that we look for.
Okay, great. Thank you.
Mhm.
So what is happening, or I'm sorry, actually, before we jump on, Heather, do you have anything to add to that of signs that a child might not be getting enough sleep, whether, as a parent or nutritionally?
I mean, as a parent, I'm going to say grumpiness, right? But that's sometimes hard to tease out because if you have a toddler, you know they are sometimes always grumpy no matter what you do. And this, sleep and nutrition has just a really interesting relationship in general because you might notice like a poor appetite of your child, and that then in turn that could relate to them not sleeping well and then cause them not to eat well. And so it could be this real cyclical relationship that you see. So I guess not eating well might be one of the signs that you could potentially notice.
Okay, great. Thank you. Bryce, are there any nutrient deficiencies that disrupt sleep?
The list is long. I'll be as top line as I can, but perhaps before I do, I'll just add one more to the list to, when you're thinking about maybe seeing a doctor like Dr. Liddell or a pediatrician, and that's snoring. OSA, or obstructive sleep apnea, is not quite as common, but getting there as it affects the adult population. And that's because of obesity affecting the younger generation. And as well, immunological discrepancies, which perhaps we have time to get into a little bit later on. That's when the adenoids and the tonsils and the things that could potentially be enlarged, the back of the throat, nasopharyngeal area, can close and prevent that good, that pathway. And then one more thing, and I know they would agree with me, and that's enuresis, or bedwetting, that's persistent after the age of 7. I think that's another, which, by the way, nutritionally, we'll segue that way, potentially represents food sensitivities. And so it's a good thing to look into that. So if you have food sensitivities, it's nothing to do with what's good or bad. Strawberries are healthy, and so are nuts. And a lot of children have allergies and overt sensitivities to those things. So it's worthy of considering food sensitivity analysis. Now, where this can be a little bit invasive, that is to say, whole blood draw, in order to assess properly under the guidance of a physician or qualified healthcare practitioner that looks at these things. It's really getting this checklist of those ingredients within foods. They're called immunoglobulins that ultimately affect the immune system and can trigger poor or disrupted sleep. And things like enuresis, so it throws the child's immune system off. And to that end, I would suggest, there's a caveat here, and we're learning a lot more about this in the last 10 years clinically, and that is something called zonulin in the gut. If zonulin, which actually represents a tight junction in the gut that prevents permeability of certain things into the general circulation. Of course, we're all permeable. We have to be to absorb the micronutrients that I'm about to get to. But at the end of the day, if we're hyperpermeable, we may be leaking, and this is affectionately termed leaky gut syndrome, we may be leaking certain things in, endotoxins, bacterial fragments, foods, chains of carbohydrates and proteins that trigger the immune system. So if zonulin is high, I encourage folks to take note of this, ZON Lunin, zonulin. This is something that you're going to want to rule out, because if it is high in the child, then doing a food sensitivity panel is probably going to show up with a lot of false positives. That is to say, a lot of things that you might be trying to avoid that child are probably not worthy of avoiding. So the solution is really fixing the integrity of the gut membrane to begin with. So this might be because the child eats too many, snacks, cakes, cookies, junk. Gluten is a big one to blame. So is dairy. And you want to rule those things out, and of course, maybe avoid them and work on healing the gut. But data shows, to get finally to your question and answer, data shows that, eating less fiber as a nation, most of us, and certainly children, are fiber deficient, both soluble and insoluble, and more sugar throughout the day is linked with lighter, less restorative sleep. And of course, children aged 3 to 9, this is important to note, sent to the Schneider Children's Medical Center in Israel for specialist growth assessments. And this is done, professionally, it's in the literature, found that adequate nutritional intake is associated with better sleep patterns and enhanced linear growth. So particularly in this cohort of individuals, these children who had failure to thrive, they were otherwise potentially, not to the scale that a pediatrician like Dr. Liddell would look at. You may want to consider ramping up their amount of pure protein. Studies show that arginine was important. Some of the letter vitamins like vitamin D, C, E. Magnesium, that's another crucial one. It relaxes the muscles, but also the nervous system. A lot of us have deficiencies of magnesium in North America. Simply the soils are deficient. Iron, and iron deficiency anemia, not necessarily just the child being iron deficient, but if they come from a parent who has chronic iron deficiency, we can assume with pretty good certainty that when they were being carried in utero, they may have also had iron deficiency. It's hard to catch up for that one. Of course, there's testing for that. Ferritin, omega-3. I'll quickly just say omega-3 is so important, DHA, EPA for the growth of the brain and nervous system, but studies correlate. In fact, one from the University of Oxford, they gave 600 milligrams of DHA for 16 weeks to 145 children experiencing sleep issues. These children added a year of good quality sleep to their night times. All right. Vitamin D, we can talk about a circadian rhythm, and vitamin B6. If you see your child has restless leg syndrome, sometimes B6 is to blame. I'm going to stop there.
Thank you. Thank you for the information. We definitely know that that study at Schneider's very, very well. Actually, the product of that study was our Healthy Heights products. So we agree that, protein, sound nutrition, hugely important in optimal growth for children. So this question will go back to Dr. Liddell. What's happening while children sleep that promotes growth?
Yeah, well, the biggest thing is a hormone called growth hormone, and that's something that gets released by the brain primarily when you're asleep. It does have this weird kind of cyclical pattern to it a little bit, but the majority of it gets released during that first couple hours of your sleep. So getting to sleep at the right time, falling asleep easily, these all impact how well your growth hormone gets released from your brain. And when you think of growth hormone, you might think, oh yeah, that just makes me bigger, right? Like that, but it's actually a lot more than that. So it's way down at the small levels of how well your muscles and your bones are developing and growing. So it's not just a stature and size thing, but it's a health and quality of your musculoskeletal system, and how well your overall body grows. So that's the big one, is growth hormone release in that first couple hours of your sleep.
Great. Thank you. This one's also for Dr. Liddell here. What are some common sleep disorders in children that, are commonly diagnosed or are commonly overlooked?
Yeah, well, one already got mentioned by Bryce, which is obstructive sleep apnea. So that's where that looking for snoring can be a big problem. So one of the primary symptoms of obstructive sleep apnea is snoring most nights, even when you're feeling well, possibly having disordered breathing patterns while you're asleep, having to lay in certain positions in order to keep your airway open. These are all signs that if a parent's noticing, that can definitely impact your sleep. So if the airway is not open and the child's not breathing well, it impacts, one, can they stay asleep, but then two, the quality of their sleep. So obstructive sleep apnea is something we see kind of all the time in that preschool to early school age kids that we don't want to miss. We also think about a bunch of disorders that we lump together called parasomnias. Those are the ones that all parents kind of get freaked out about. So those are things like sleepwalking and sleep talking, nightmares and sleep terrors. So most of those happen in certain stages of sleep. So the sleepwalking and sleep talking, those are primarily in the early hours of sleep, so usually before midnight. And the child often doesn't remember the interaction. They're really difficult to arouse. They're able to carry a conversation, but oftentimes they're just confused, and they can't really tell a linear story when they're questioned. And then they almost immediately kind of go right back to sleep. And then in the morning when you ask them, they're like, I don't remember that happening at all. So that's often sleepwalking, sleep talking. There's also something called sleep terrors, which are more common in kind of the toddler, younger preschool ages. And this is where the child just kind of wakes up, same kind of thing, in the middle of the night, early night hours, just really crying and screaming and being unconsolable. And those periods can last for minutes, even up to half an hour, maybe an hour sometimes. And it's really hard for the parents to calm the child down and get them back to sleep. The good news is they also don't remember that when they wake up in the morning either. So all of those are kind of the same stages of sleep that happen. That's a little different than a nightmare, which is usually later in the night, so early morning hours, where a kid wakes up from this really vivid dream that can be really scary. The interesting thing about nightmares is you remember them, and you often have a hard time falling back asleep because of the stage of sleep that they're in. But those can be scary for parents, kind of all of those parasomnias. And then I guess maybe the last category, well, a couple more I could think of. So restless leg syndrome was mentioned briefly. That can sometimes be associated with iron deficiency, anemia, or other micronutrient deficiencies. And that's primarily where the child feels this just urge to wrestle the legs and kind of be moving. It can actually happen before sleep onset, but then also right as they fall asleep. And it can really disrupt their sleep. And then there's some behavioral insomnias, which is like, you know, for infants, they're always either being rocked or bottle fed or breastfed, and they really have to have that same behavioral pattern in order to fall back asleep. And that can transition from infancy into that toddler age group, where now the toddler needs this whole drawn out, big, long kind of bedtime routine in order to fall asleep. And then that starts impacting them when they wake up in the middle of the night. They want their parents to do the whole routine over and over again. And you can see how that pattern just continues through. And so we call those behavioral insomnias, where it's more working on the behavior than a medical condition. I think those are probably the big ones that we see quite often.
Okay, great. Thank you. Do you find that, I mean, a lot of these that you just spoke about had to do with like disruptive sleep or disrupting their sleep. Do you see that this affects growth and development?
Yeah, it definitely can, especially obstructive sleep apnea, restless leg syndrome. Most of the parasomnias are not as urgent. One, because the child doesn't remember them. So it's more an effect on the parent than anything else. But yeah, all of them can affect the quality of your sleep. And then like we were talking about before, the poor quality of sleep can then lead to poor nutrition. And now you just got this kind of vicious cycle going.
Right, right. Heather, do you have anything to add about, besides like the iron deficiency, but common like sleep disorders in children that you see with, nutrient deficiencies or just effects of nutrient deficiencies in sleep?
Yeah, I mean, I think we touched on a lot of those nutrients that Bryce did. I will add in there that we kind of talked about like the growth hormone and how that can be helpful or how that's needed once we get that good sleep. And in addition to that, we call ghrelin and leptin and that like relationship there. That we have ghrelin, which is this hormone that is released in those first few hours of sleep, and that really helps us with the hunger, knowing when we're fully hungry and being able to get hungry. So that level is going to be high, like right before we eat a meal, right? And then we have leptin that is countering that and lets our body know when we've had enough. So when we have these disruptive sleep patterns, that is another thing that is affected. And then we have a cycle of the ghrelin is too high and the leptin is too low. So then we have kids who might be too hungry or feeling like they are never fully satisfied because their ghrelin's elevated and their leptin is decreased.
Okay, great. Thank you for that. Thank you for that explanation of the ghrelin and leptin. Definitely very important. And I feel like a lot of people don't, those hormones aren't common knowledge that are really important. Bryce, this question is for you. How does sleep affect eating behaviors?
Yeah, no. So, I mean, to add right onto that in terms of, what Heather just described, it will really mess with your appetite. There's a couple of things that in clinical practice, we're seeing some trends. I do a lot of genetic sequencing. These are pathway genomics for all ages, and functional neurotransmitter panels. That sounds like a lot, but really what it's looking at is neurotransmitter behaviors and patterns in, children throughout adults. And sleep affects both of these things. And on top of those, our ability to detoxify. We've just identified this sort of new system within the brain. We have lymph tissue. A lot of us are familiar with lymphatics with an L. In the brain, we don't have lymph, but we do have, a significant amount of glial cells. And they're non-thinking cells. There's a tremendous amount of them. Their responsibility is to detoxify the brain. And this is not talking about these ethereal toxins in the environment, heavy metals and industrial chemicals. We're talking about simply metabolic end products. So to think, and children are much more active thinkers. The more you think, ultimately, the more deep sleep you have to have. This is involved in neuroplasticity, the ability of nerves to connect and disconnect, and for us to form new memories and thoughts, and all kinds of different things. So if you're a poor detoxifier and your lymphatic system's not optimal, you even need that much more sleep. And frankly, we have to, and I know we'll probably get to this, optimizing sleep hygiene. One of the things that's so important for a child who's not so optimal genetically insofar as these detox pathways and the lymphatic system is potentially not optimized, we want to pay attention to the fact that they should probably be sleeping in a cool environment, make sure that they're not exposed to improper sleep hygiene. Therefore, getting the deepest form of sleep, because that's the only time, per Dr. Liddell's suggestion earlier, HGH, human growth hormone, is elevated in the first few hours. The lymphatic system detoxifies for the subsequent hours, and without cool, dark, very comfortable environments, this system is not working as efficiently. And I'll just tie up that neurotransmitter component there as it pertains directly to sleep and nutrition. If we were to find, for example, a child who genetically and even functionally lifetime was low for serotonergic production, we may make nutritional recommendations such as trying to incorporate pumpkin seeds, very high in tryptophan, the precursor to serotonin, into their diet. Maybe even go so far as giving them amino acid therapy, which is nutrition. Sometimes I refer to this as you can't eat yourself to therapeutic ranges, but ultimately taking an ingredient like 5-hydroxytryptophan at safe doses, very indicated for the child, that might actually convert to a better, deeper sleep.
Okay, great. Thank you. Heather, going back to you, we kind of touched on this briefly, but I want to get in a little more depth to this. Do you see nutritional intake impacting quality of sleep?
Sure, I think we can see that in a lot of literature and research that has been done over the years. We kind of touched on this a little bit, but often we think of what's wrong with our kids' diet, and we focus and are concerned about, processed food, junk food, high sugar, high carbohydrate. And all those things have been shown to potentially cause issues with sleep or make sleep have less quality of sleep, more waking up through the night and those types of things. So focusing on like a healthy, well-balanced diet, whole grains, lean proteins, wide variety of fruits and vegetables, high fiber, all those things are going to be vital to not only your child's nutrition, but that, goes with growth and health and your sleep hygiene as well.
Okay, great. Do you find that the timing of meals affects sleep?
It can. Yes and no, I'll say. So
Okay.
yes, in the fact that, we can think like if we were to have a really large meal right before bed, our stomach might be upset. We might not get the best sleep because we're in those early stages of digestion, right? So we can say that pretty convincingly that we want to have a meal and then have a couple hours before we go to bed. That's definitely going to be important. And then on the flip side, a lot of kids aren't, what we deal with, or what I see are a lot of picky eaters, right? So kids aren't eating a ton at dinner time. Usually dinner time is the hardest meal for kids to eat. So then either they're going to bed hungry or they're not eating dinner and then getting a bedtime snack. So first I'll say, if your child's going to bed and they physically are hungry, that's going to affect how well they can fall asleep. And then those growth hormones, the ghrelin production, all that's going to be affected. So if they truly are hungry, we want to offer a bedtime snack. And many parents do that, but then are stuck or have issues because their kid wants a bedtime snack, but they want cookies or they want a Pop-Tart or a granola bar or something like that,
Right.
which are often, maybe highly processed foods, higher in sugar. And we want as much as we can to have a more balanced, healthful snack for them. And we always say or encourage people, yes, if you want to give a bedtime snack, do it, but try and keep it boring. So focus on like protein-rich, fiber-rich foods. I sometimes say like pair a protein and a produce together, something like that it's not going to be this super exciting thing, but if you're hungry, yeah, we can have cheese and apples or something like that. And that can really help a child who is hungry and not eating a lot at the dinner meal to be able to feel more satisfied and get to bed easier.
Okay, great. Thank you. Bryce, do you have anything to add about the timing of meals?
So, I mean, a general rule of thumb, I would suggest perhaps, you'd want to study, you'd want to know your child for sure, because I'm all about N of one personalized medicine. So understanding the individual, if they tend to have enzymatic discrepancies identifiable, through various tests or, assays, they tend to be, that individual who's got seemingly a longer transit time, so just more guts. Some of us have longer intestines than others. They're going to be more active. The brain gut connection is quite well established now. So again, to the previous point, the more that you're consuming, the closer to bed, the more activity there might be in this second brain of ours might alert and cause the first brain to have a problem going to sleep. So full circle to that rule of thumb, I would just sort of generally suggest nothing closer than an hour for sure, maybe even 2 hours prior to bed. And certainly if you've already identified that your child's lactose intolerant, and that just means it's not gonna hurt them, but that just means identifying those things with dairy. You probably for sure don't want to let them have a slice of pizza before bed. So avoiding those food sensitivities that could ultimately stimulate, as I alluded to earlier, disrupted sleep, latent sleep, enuresis, bedwetting, etc.
Okay, thank you. Dr. Liddell, what are some of the short-term and long-term effects of poor sleep in children?
Yeah, the short-term stuff is the stuff that parents always struggle with. Stress, emotional distress, mood disorders, leading all the way to certain mental health conditions, struggling with their cognition and performance, sometimes even somatic symptoms of body aches and muscle aches and joint pains and those kind of things. So those are the short-term battles. The long-term stuff is what our adult physicians and medical teams worry about, which are things like hypertension and dyslipidemias, which lead to coronary artery disease and early heart attacks and strokes. Metabolic syndrome, where you're struggling with your blood sugar staying in check, all the way up to diabetes. There's some links to certain types of cancers as well. So yeah, those aren't the things I necessarily think about as a pediatrician, but those are the things that impact your lifelong health. So, and it's so interesting that that's tied to nutrition and sleep at a young age.
Right. Thank you.
Yeah.
So this question's kind of open-ended, but I'll start with Heather here. How can parents create an environment for optimal sleep for their children?
Sure. So there's so many things you can do and touch on, but I think a good routine is where most people want to start. So knowing, just like we did when we had infants, of where we maybe swaddled them or changed their diaper, swaddled them, fed them, put them to bed in a dark room. We want to continue those types of routines like as our kids get older. So thinking like even now we have almost 10-year-old, 7-year-old, and 4-year-old, and we still go through the same rhythm and cycle every night of like, we're going to take a bath, we're going to brush our teeth, we're going to get in jammies, we're going to read together, settle down, and then we'll go to bed. So creating that structure can be really helpful for sleep and just give that security that kids need as they continue to grow.
Yeah, and I would add on a few other things. I mean, like we alluded to before, like having a cool and dark room can be very important for how the brain gets ready for sleep. Sometimes for the older kids, making sure that they take like a nice warm shower to raise their body temperature and then allow themselves to then cool down as they go to bed. So that's why the shower or a bath time can be important for kind of helping with those temperature shifts. Another big problem we see is just distractibility when it comes to sleep. So making sure the bedroom is for sleep, which for kids can be hard. So you don't want all their toys out and you don't want screens available and bright lights and all that kind of stuff. So the actual go to sleep time after your routine should be pretty brief and pretty straightforward and shouldn't be very elaborate as long as those other things are in place ahead of time.
Okay, great. Bryce, do you have anything to add?
Yeah, no, sure. First, I'd like to echo those sentiments. My parental experience, I now have a 16-year-old boy, 14-year-old girl, but those days of pre-bed routine are still quite fresh. I would say to that end, for Heather's mention of routine, It's routine, routine, routine. To Dr. Liddell's mention, of sleep hygiene, I would only add something of a technique that I got into, not substantiated tremendously in the literature, becoming better. And that's to teach them early about alpha wave, which is that sort of state of increased focus, attention, alertness, concentration, but also relaxed. And that can be induced by simple mechanisms or techniques, one known as box breathing. Perhaps we've heard of that before, but teaching the child how to breathe, for especially anxious children, those that, are night terrors, frequently like hamster wheels, and all parents know who they are, that they've got those children or not. But box breathing is a count of 4 in, holding for 4, count of 4 out, holding for 4, count of 4 in, and you repeat that for a couple of minutes. That can induce alpha wave. There's also downloadable music, alpha wave type music, maybe affectionately known as Muzak, but it's kind of like the elevator music or the stuff you hear in the spa. I mean, that kind of music to relax the child, minimizing stimulation across all senses. Again, to echo that sentiment, not just the lights we think about, but also sensory, touch, sound. I mean, you don't want to ask them to throw down their iPad or iPhone or smartphone only to replace it with blasting hip hop music. It's not going to do so well to get them into that alpha state. I personally taught my children, they love this gamification using, and you can do this now actually for free or very little money with apps. You put your finger on the back of a smartphone. So again, to minimize the blue light exposure, you switch it, and all these smartphones have it over to that more orangey nighttime, so you're not inducing those light waves. But you find an app that looks at heart rate variability. Kids love this. So the finger at the back of the flashlight looks at their equivalent of sort of a pulse rate, but the beats of time between that. And when they breathe and do the box breath and they see an optimized heart rate variability, that sets them up really nicely to get into that sort of mode of sleep, and just sort of seems to enhance sleep architecture or the necessity of us to get down these sort of steps before reaching this deep. So it establishes that front end alpha wave. And by the way, another nutritional sort of tip, it's in literature, over 85 clinically done trials, 5 of which were done with attention deficit hyperactivity in children, very safe, is called theanine. This is an amino acid, incredibly safe, that also helps to induce, studies were done at 200 milligrams twice a day, to induce alpha wave activity, specifically to help those individuals with ADHD, whether or not you're taking medications in that class that help them in that area as well. So it enhanced their sleep profiles, aside from during the day, their attention and their alertness, focused concentration, while at the same time relaxing them.
Mm-hmm. Bryce, what are your thoughts on giving a child melatonin if they are having a hard time falling asleep at night or winding down?
Yeah, so melatonin is a hormone that's produced by the pineal gland, the center of the brain. It's suppressed, or the cycle is switched during the day upon exposure to light. I was talking about serotonin earlier, so that's the light, day dominant, feel good. We know it as the mood hormone, but there's a sort of circadian rhythm between day and night. Day is serotonin, night is melatonin. So we naturally produce this as we age, starting in our mid-30s particularly, and certainly this, the circadian rhythm is so messed up with, diet and lifestyle and this, excessive exposure to light and stress. So many of us into our, later 30s and beyond become deficient in this hormone. I'm a huge advocate of a replacement therapy, like you'd be deficient in vitamin D. Also, by the way, very important in the circadian rhythm balance. Many of us, certainly those north of 40 degrees latitude, where a lot of us live, are deficient in this vitamin D. But specifically to your point, I'm really an advocate of leveraging, when not so invasive, laboratory technology to determine the individual N of 1, that person's level, certainly as it relates to a hormone, before treating. In the literature, I would hazard to say like 0.5 milligrams per kilogram of body weight is probably extremely safe. No more than that. And so that's, leading to the most, in a child, no more than about, 5 per 10 kilograms. Let me take that. So 0.5 per 10 kilograms. So the low dose is often what's needed, 1, 2, 3 milligrams, and that's to help them get off to sleep. For advanced phase sleep disorder, they're waking up too early. Don't really advise it. It doesn't seem to work so effectively. But to my point of testing, it's a simple urinary test. If you find the child is low, on a urinary melatonin test, that might be further evidence to supplement with melatonin. So I think there's a pretty decent safety profile, but again, I'm a little, conservative when it comes to hormones, in this case, neurohormones, and just sort of flagrantly feed high doses to a child just because it's an over-the-counter natural healthcare product.
Thank you. Dr. Liddell or Heather, do you guys have anything to add to melatonin within your practices or with your kids, or any research you know of?
Yeah, I mean,
we love it for our kids.
Yeah, we often utilize melatonin with our patients quite a bit. I agree with the dosing, like low and slow. I like to use melatonin when we're working on other bedtime hygiene stuff too. So it's not here, take this med every night indefinitely and not work on stuff. It's, hey, how do we reset the clock, kind of work on bedtime routine while we're trying to get all the other stuff in place. And then we talk about trying to get back off of the medicine if we can. Because a lot of sleep is behaviorally driven, like we were just talking about. But a medicine can help you get there if you need it. So yeah, we use it. There's pretty good literature in our pediatrics research that you can go up as high as 5, maybe 10 milligrams for older kids. But I try and stick lower than that if I can. And then in my practice, I use other prescription medicines sometimes when, maybe it's a neuroatypical kid with something like ADHD or autism, and they're just known to struggle to get to sleep. And we start running out of ideas once we've optimized all the behavioral side of it, and melatonin's not enough, then yeah, we'll sometimes go to prescription medicines as well to help with sleep.
Okay, great. Do you guys have, before we jump to, it looks like we have a good bit of questions from the audience right now. So before we get there, do either of you guys or any of you guys have any topics you want to talk about with the intersection of sleep and nutrition before we move on to some audience questions?
I'd just add one thing, if that's okay. Think about caffeine for the older kids. So teenagers love caffeine, and it's in all their energy drinks, and it's sneaking into sports drinks, and then coffee and tea and soda. So, know where your kids are at with their caffeine intake. I mean, you need to think about other things like chocolates. Yeah. So yeah, caffeine.
Cool.
It's exactly what I was going to throw in there. So that's maybe a perfect segue into the questions, if you agree, Heather.
Yeah, good job, guys.
Well, since we're on the topic and we're going to do, we have some fact and fiction coming up. What do you guys think about, does caffeine affect growth? Does it stunt your growth? I remember I'm 5'10", so it clearly didn't happen, but they were like, if you drink tea, it'll stunt your growth. Do you guys have anything to add on that?
Well, I'm interested. I honestly haven't looked at the literature on this topic, I guess, in enough. But it would make sense that if caffeine's impacting your quality of sleep or limiting your hours of sleep, like we talked about, poor sleep then leads to poor hormonal changes, which leads to poor growth and poor diet. So somewhere in that cycle, I could definitely see how excessive caffeine would lead to poor nutrition and poorer sleep, and then eventually poorer growth.
I would just add to that and say, paradoxically, if you're reaching for the caffeine and or pseudo addicted to it, it's probably representative of some underlying potentially sleep issue and or even poor diet. It's really hard to make these direct associations and even study for a multiplicity of variables. But the conjecture I would sort of share would be, if you're over consuming sugar and as a child, a younger adolescent, caffeine, my guess is you're probably also lining up at the fast food, restaurant and or lacking clean, real energy and then reaching for the stimulants would be my guess. And therefore, if you are probably not sleeping very effectively and maybe not even exercising, all those things you need for optimal growth.
Okay, great. So I have another question here. When a child is having disruptive sleep during the night and say they wake up really tired, they're having a hard time staying awake during the day, are daytime naps helpful, or are they more disruptive to their nighttime sleep? That's for anybody.
Yeah, I think their age is a big part of it. So for me, like once a kid's kind of 4 years or older, I really try and get them away from those daytime naps. The younger kids, yeah, we do worry about just their overall total number of hours of sleep through the day. And obviously we want the majority of that at night. But yeah, once they're school age and above, I really try and hold off on the daytime nap and work on optimizing their nighttime sleep.
Mm-hmm. Okay, great.
Dr.
So
Liddell may correct me on this, but ultimately the way I think about it is certainly, again, after those ages where you'd expect a child to be napping under 4. If they're not, that's probably an issue. Beyond, 4 or 5 years old, if they're napping, I've actually referred to this as a trucker's nap, and I think this applies to adults as well. It's appreciating first and foremost sleep architecture. So with that said, you're trying to get down these different sort of steps into a deep phase sleep. You bounce up into REM, a lighter phase sleep where the eyes are jerking back and forward. The literature suggests that, the average, later adolescent adult, at least I can speak more to that category, requires to go through at least 4 or 5 minimum of those various phases, to which most of us require 60 to 90 minutes to get through one. So if you do the quick and dirty back of the napkin cowboy math, that means you need at least 7 to 8 hours, where we hear about that number. But if you're napping, I guess is where I would say you don't want to get into that full cycle, which I think the literature suggests that getting into that full cycle then further interrupts sleep at night. I would ask Dr. Liddell to confirm that, because
yeah, no, that's exactly right. Those shorter cat naps are what we're going for adults. 30 minutes, recover. Once you go beyond that, you run the risk of getting into your next cycle and impacting your nighttime sleep.
Mm-hmm. Great. Thank you, guys. So this topic's definitely very relevant right now with, you guys all touched on the importance of routine, and with daylight savings time happening, do you guys have any tips to kind of, change that routine to fit the time change, or have you seen any difficulty with that in your own kids, and tips that you have?
Sure. I'll say blackout curtains are like our friend because here where we live now, we're going to get into the summer here where it's going to be sunny until 9 o'clock or later at night, and probably even later where Bryce is. But it stays light late, and so yes, blackout curtains are good. And even like if you're in your home and like you're getting your kids just settled and getting into that routine, I would like close all the blinds. Like if we're downstairs, all the blinds are closing while we're settling in and reading or doing whatever our routine is for the day to like help them get into that mindset of nighttime.
Mm-hmm.
Bryce,
do you have anything to add?
Well, I would say, we've heard a lot about, bedtime and routine and establishing, the necessity. And I'm a full believer in that, especially for children. What I've come to learn, this is Dr. Huberman, neuroscientist. I've come to learn, it is so important to reset in the morning. So again, blackout blinds, but have a regular morning routine wake up time. Seems that the science is more, is stronger toward that, resetting, stopping melatonin, initiating serotonin, because, even if it's a child and, spring forward is in effect, and then they lose that hour, to make that happen as minimal days in a row as possible. The interruption would be to, cause that 1 hour loss, guarantee that they wake up exactly if it's over a weekend, the next morning at the same time is more likely to establish that regularity and make them get that the consistency of the amount of sleep. So I guess what I'm suggesting here is making sure that you have as often as possible the same wake up time. For children, routine's important. And then even an alarm to remind us as to when to go to sleep in order to establish that routine. So we're so used to the wake up alarm. I think for the family, especially those with young children, I think that go to sleep alarm should probably go off at about half an hour prior to sleep to alert the whole family. Yeah, we're in our sort of go to bed routine now.
Mm-hmm. Okay, great. Dr. Liddell, anything else?
No, that all sounds excellent. Yeah.
Great. Great. Thank you, guys. So Heather, you did touch on this with recommending when your child does want to snack before bed, if they are hungry, having a protein and a produce, and avoiding processed foods. But what exactly is the effect of processed foods that children can look, or that you can look out for with sleep?
Sure. So
within relationships.
One of the things we're concerned with is that when we're eating highly processed, high sugar, high carb foods, they're simple carbohydrates. So our body is digesting them quickly, and you have probably heard of like a really high, and then we're crashing down. And when those happen in our bloodstream, it can affect sleep, where if you're having high carbohydrate foods, studies have shown that you feel drowsy, but that when you sleep after that, that you're more disrupted during those sleeping hours. So that's one of the things that we're trying to avoid.
Okay, great. Thank you.
Yeah.
Bryce, do you have anything to add to that with the processed foods?
Yeah, I would just say sort of a small addition would be that the trend in that consumption of processed foods, processed ultimately translates to micronutrient deficient. And so they don't have the omegas that we were talking about early, the vitamin D, the vitamin C, all these micronutrients, vitamins and minerals, magnesium from whole grains versus refined. So again, the refinedness takes out the micronutrients. The micronutrients ultimately is what helps us to establish deep, rich, rejuvenative sleep.
Okay, great. Well, it looks like that is about all the time we have for the audience questions now, but we will be answering the rest of the questions in an email that will be sent out within 24 hours. So we really appreciate everybody joining on, and really, really thank you, all three of you, for joining. This was really informative, and we got through a lot of great content. We really loved having you, and we look forward to seeing you guys again soon. Once again, a recording of this webinar will be emailed to all the guests within 24 hours, as well as a 25% off coupon to use on our Healthy Heights website. And that Schneider's clinical study that Bryce touched on earlier about the importance of nutrition for growth is also on our Healthy Heights website. If anybody wants to check that out, it's really great, and it's really informative. And we're looking forward to seeing all of you again at our next webinar. Thank you guys a lot.
Thanks, Dr. Liddell.
Thanks,
Heather. You guys, all the best.
Yeah, you too, Bryce. Bye.
Bye.